This program is meant to present nutritional information only and is in no way meant to replace the advice of your medical doctor.
Dr. Joel Wallach here for Longevity 9 for Life Crusade. And Doug, let's go to callers.
Let's head to Pennsylvania. And David, you're on with Dr. Wallach.
Hello, David, you're on the air.
Hello there, Dr. Wallach.
Yes, sir. How can we help you?
My wife has had issues with diabetes, and actually my daughter...
No, type 1 or type 2? Type 1 or type 2?
Type 2.
Okay.
And my wife is, she's lost a lot of weight. She's, looking pretty good, but my daughter actually she doesn't have to be on her diabetes medicine at all. Her blood sugar is excellent, but her weight's still heavy.
Okay, so your daughter also has type 2 diabetes.
Yeah, she was diagnosed, but about a year ago she was prayed for, and she hasn't had any issues as far as her blood sugar. Her blood sugar's been, right around 100.
Now, how much does your wife weigh?
My wife weighs 130, and she's 5'3".
Okay, that's about right. And how much does your daughter weigh?
I'm thinking that she's about 170, and she's
170.
Yeah.
I'm sorry. How tall is she?
She's 5'3" too.
Okay, so I would say she's about 30 pounds overweight. All right. So what I would do is give both of them the same exact stuff, but your wife's going to take half as much as your daughter. Okay. And you're going to have to kind of be simpatico here and do some of the same dietary changes. And everybody needs to get off of the fried foods, processed meats, oils, gluten, and sugar. That means fruit and juices. You can get everything you need from fruit and juices from steamed vegetables with butter on it without the mess around with the sugar part. So by no oils, I mean no microwave popcorn, no theater popcorn, no olive oil, coconut oil, margarines, mayonnaise, cooking oils, and then no gluten, no wheat, barley, and oats to maximize absorption. And again, your wife's going to take one of these things per month, and your daughter's going to take two until she gets down to about the same weight as your wife. So I'll give you one, and you can just double this for the daughter. Okay, so your wife should take one Healthy Brain and Heart pack per month. I would throw in 2 bottles of Sweet Eze, okay, and there would be 3 of the Sweet Eze at breakfast and dinner. In the Healthy Brain and Heart pack, a half a dose of everything at breakfast, half a dose of everything at dinner time. Your daughter's going to have 2 Healthy Brain and Heart packs per month and 3 bottles of Sweet Eze, so she could take 3 at breakfast, 3 at lunch, 3 at dinner, okay, and take their fasting blood sugar. If your daughter's off of medication, that's a good thing, but she still needs this stuff. And if she's managing her diet good, well, but she still has the weight challenge. And your wife needs to make sure she's getting these nutrients because they're not in the food anymore. That's the problem when you have type 2 diabetes. And, of course, she can take her fasting blood sugar before she medicates herself. And as her blood sugar goes down, 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 which it will, if she's on a gluten-free diet and no sugar and none of the other bad stuff, no gluten, what's going to happen is her blood sugar will go down or just regularly, and so she'll be able to reduce the medication until she's got her blood sugar below 100 for 2 or 3 weeks without medication. Then she's an ex-diabetic. And, of course, they all need to say, people always say, well, how long do I have to stay on this stuff? Well, as long as you have oxygen, because the food in your area doesn't apparently have enough of these nutrients in them, or maybe not at all. And if you every once in a while get some imported food from other states or something like that, or neighboring counties, you might get a little bit of something, but not consistency. And that's why they have type 2 diabetes. It's not a genetic thing. And so it wouldn't hurt for you guys to get that book, Epigenetics, and the book, Hell's Kitchen, so you can understand type 2 diabetes very well. And you'll just shake your head and say, man, how did the doctors miss it this badly? Because it is so simple. It's been a known single nutrient deficiency for 85 years, but the power of the genetics community overwhelmed the truth. Well, thank you, everybody.